Hi everyone. So today we'll be starting with the third lecture of OMM, which is about non-keratinized mucosa. Okay, so this is the biggest topic in the chapter, and mostly the questions, the long answers are framed from this topic only, from the gingiva and hard palate. So just to walk you through, to review this, whatever we have studied till now, we know the structure of the OMM. So it has an epithelium, it has a lamina propria, and it has a submucosa. Right, based on the keratinization of the epithelium, it is divided on keratinized and non-keratinized epithelium. The keratinized epithelium, it has masticatory mucosa and vermilion border of lip. Okay, the masticatory mucosa includes the gingiva and the hard palate, and the vermilion border of lip, it is not included in the masticatory mucosa. We'll study that. This generally comes in for a short note, and these two are part of LEQs. So these two are really important for you from your exam perspective. And the structures, the question that is generally asked is regarding the macroscopic and the microscopic features. Okay, so in my notes, these are it is in the form of macroscopic and microscopic features. That's how I have structured the topics, and you can directly memorize from these. From this for your exams, I'll put it on my Telegram channel. Okay, so starting with the hard palate. So first topic is the hard palate. Hard palate, it is the bony front of the roof of the mouth. It separates the oral and the nasal cavities. Okay. It is composed of maxilla and palatine bones and covered by a mucosa membrane. So what this definition is saying, that if I have this, this is my face, okay, this is my mouth. Over here will be the hard palate, right? So it is a bony roof of my mouth, bony roof. Okay, it separates the nasal cavity and the oral cavity. So it is separating the two. It is composed of maxilla and palatine bones. So the bones forming the hard palate, that is the maxilla and the palatine bones, and it is covered by a mucosa membrane. Okay, so this is the definition of the hard palate. Coming to the macroscopic features, the main three features that we have will study first, that is the incisive papilla, palatine rugae, and the epithelial pulse. Okay, and then we'll go to study about the zones of the hard palate. So the first feature, that is the palatine rugae. These are basically asymmetrical foldings that are present on the roof of your mouth in the anterolateral area. So this is the anterolateral area. So if you touch your tongue on the roof of your mouth, you'll feel these folds of the mucosa membrane, and basically they are just like folds of mucosa membrane where the core is made up of connective tissue. Okay, so they are also called transverse palatine ridges. They are irregular asymmetric ridges in the mucous membrane. The core is made up of dense connective tissue. Okay, so that's it for palatine rugae. Then coming to epithelial pulse. Okay, these structures are not generally visible, but these structures are present in the lamina propria. They contain concentrically arranged epithelial cells that are frequently keratinized, and they are remnants of epithelium formed at the time of fusion between palatine process. So I'll explain what this means is, so epithelial pulse, they are present in the lamina propria. What happens is, during the formation of hard palate, the two maxillary bones, they will come in from these directions and they'll fuse together. Okay, so at the time of their fusion, what might happen is that I have this epithelium, right? I have this epithelium. What might happen that some of my epithelium cells, so these are the cells of my epithelium, they might fall into the lamina propria while fusion, and they will form this concentric arrangement. And because the cells don't belong here, they might get keratinized. Okay, so this keratinized structure with the epithelium cells. This is the keratinization. These are the epithelium cells. So this keratinized structure in the lamina propria with the epithelium cells, this is called the epithelial pulse. Okay. Now moving ahead with the incisive papilla. So the incisive papilla, it is a small pear-shaped elevation located on the mucosa of the hard palate, okay, behind the maxillary central incisors. So if you look at the incisive papilla, this is a pear-shaped organ, not organ, but pear-shaped structure. It is present between the central incisors, okay, in the maxillary mucosa, and it is covered by a mucosal membrane. So we'll see what is actually in this structure. So if I remove that membrane, I'll see a structure like this. Okay. Now what is this structure? This incisive papilla, it has two openings. So first is the nasopalatine. First is the incisive foramen. Okay, incisive foramen. It contains the nasopalatine arteries and nerves. So this is the artery. This is the nerve. So it has first incisive foramen. That is the first structure, and this is the duct. Okay, nasopalatine duct. This is the second structure. So the incisive foramen, it contains arteries and nerve, and the nasopalatine duct, it used to be a duct that would connect your uh, nasal, no, the oral cavity. So if this is the hard palate and this is my nose, okay, nose, the nasopalatine duct, it used to connect the oral cavity to an organ called the Jacobson's organ. But this organ is not present in humans anymore. It used to be an olfactory organ, but the duct, it still remains, and since it is not functional, it is filled with mucus and pseudostratified epithelium. Okay, so just going over it once again, I have this incisive papilla. I removed the membrane. Okay, I found two structures. First is the incisive foramen, second is the nasopalatine duct. The incisive foramen, it has arteries and nerve, and the nasopalatine duct, it is non-functional in humans. It used to connect the oral cavity to the Jacobson's organ. Now, since it is non-functional in humans, it is filled with mucus and pseudostratified epithelium. Okay, this is all that's written over here. And that the incisive foramen through which nasopalatine nerves and vessels pass. Okay, an additional structure called the nasopalatine duct may be present, which connects the oral cavity to the Jacobson's organ, or the Jacobson's organ is also called the vomeronasal organ. Okay, it used to be an olfactory organ, right? The nasopalatine duct, this duct, is present in lower mammals but degrades in humans, where it is filled with pseudostratified epithelium and mucus. Okay, so I already explained this. Now coming to the zones of the hard palate. As your hard palate is divided into four zones. Okay, what are these four zones? So the first zone is the gingival zone. The hard palate present just adjacent to the teeth. Okay, this is the gingival zone. This is the first region, right? The second zone is the mid-palatine raphe. Okay, so this is the median structure that is present. This is the palatine region, the median area. Then the entire front area, other than this, where Yuga is present, this is called the anterolateral area. Okay, so this is the third area. And the fourth area, coming from the anterolateral area up till the soft palate, this is the posterolateral area. So we have to study the histology of these four structures, mainly about these two, the gingiva and the palatine region. They are the gingival region and the palatine region, they are very similar to the histology of the gingiva. Okay, so we won't be studying these. The questions aren't generally asked over it, over the histology of it. So this is basically these are very similar to gingiva. What is the difference between the gingival region and the anterolateral and the posterolateral region is that submucosa is absent. Okay, in the first two structures, in the gingival region and in the palatine region, the submucosa is absent. In these two, the submucosa is present. Okay, so submucosa is absent, and these are very similar to the to gingiva, which we will study after this. Okay. Now, histology of the anterolateral area and the posterolateral area. So these two have a very similar histology, except there are two major differences. Okay. So starting with the epithelium, it consists of orthokeratinized stratified squamous epithelium, and long papillae are present. So it is orthokeratinized, okay, stratum squamous epithelium in both of them, and long papillae. The papillae present are long, okay, so in both the anterolateral and the posterolateral region. Now coming to the lamina propria, it is attached to the periosteum of maxillary and mandibular bones by dense bands and trabeculae of fibrous connective tissue. Okay, so basically it is attached to the periosteum through some connective tissue, through some bands. Okay, this makes the mucous membrane immovable. It is thicker in the anterior region than the posterior. So because of this strong like bond of the lamina propria and the periosteum, and this is immovable. Okay, so the mucous membrane on your hard palate, it is not movable because of these bonds, these bands, and the lamina propria in the anterior region, in the anterolateral region, it is thicker than in the posterior region. Okay, so the posterior region one is slightly thinner, the lamina propria. Then coming to the submucosa, it is divided into various compartments because of these trabeculi. So these divide it into various compartments. This is the submucosa. So you can see like this is one compartment, this is one compartment. Okay, the compartment in the anterolateral region, it is filled with fatty tissue, but the same compartments in the posterolateral region, these are filled with glandular tissue. So this is the major difference between the anterior and the posterior region, that the submucosa, it is filled with fatty tissue in the anterior region and it is filled with glandular tissue in the posterior region. Okay, now coming to the second topic, that is the gingiva. So we're done with the hard palate. Gingiva, it is a part of the oral mucosa covering the alveolar bone ridge surrounding the tooth socket. So uh, I think it is pretty self-explanatory, but just to go over it, this is the tooth. Okay, this is the root, and this is the alveolar bone in which the root is embedded. Now, gingiva, it is a part of the oral mucosa that covers the alveolar bone surrounding the tooth socket. So it covers the alveolar bone uh, surrounding the. So this is the tooth socket. All right. So this is the gingiva. That is the definition. Right. So coming to the macroscopic features of the gingiva, it is pale pink in color, but the color may vary. Okay, the color depends on various features, on various pathologies as well. Gingiva is characterized by stippling. So what is stippling? These are elevations and depressions on the surface, not very clear, but you can see over here the rough things you can see, okay, like oranges. There are some pits, like tiny pits, these elevations and depressions, this is called stippling. So this is a characteristic feature of gingiva. The stippling, it is a mechanical adaptation. Okay, so it is for mechanical impact, and it is a clinically important sign as well. It is important for a healthy gingiva, so it is an indicator of a healthy gingiva. So if stippling is absent on any gingiva, that is a sign of gingivitis. Okay, so that is inflammation. If your gingiva is inflamed, there will be no stippling. Now, male gingiva is more heavily stippled than females, so males will have more of this stippling. Blood supply of the gingiva, it is mainly through branches of alveolar arteries that pass upwards through the interdental septa. So what will happen is I have two tooth, okay, I have this teeth, okay, and I will have these are two teeth, and I will have a branch of the alveolar artery that will come up here through interdental septa, and it will go upward and it will like branch out and supply the gingiva. Okay, so this is regarding blood supply. Now coming to the parts of gingiva, this is also a part of the macroscopic features. So this is the cut section. Okay, if I had this if I have this tooth, right, this is the tooth, and I take this part and this is the gingiva. So if this was the gingiva, right, so this is what you're seeing over here, right? So the gingiva, it is firstly divided into three parts. First is the, I'll use a different highlighter here. First is the free or marginal gingiva. So this entire part over here, okay, this is the free or the marginal gingiva. Then the second part, it is the attached gingiva. And the third part, this is the alveolar mucosa. So if you look in this diagram over here, I'll zoom in on these three parts. This part over here, okay, you see this part, something up till here, this is the free gingiva. Free gingiva means it is not attached to the alveolar bone underneath. Okay. Then until you see this color change, this is the attached gingiva. Okay. And when you see this color change, this is the mucosa. Okay. So these are the first three major parts of the gingiva. Now, as I told you, over here you can see the free gingiva. It is not attached to the alveolar bone. Okay. It is not attached to the alveolar bone or the tooth structure. It is not attached to the tooth structure. So this empty space between the tooth and the gingiva, this is called the gingival sulcus. Okay. And then you will see a line. A line you can see over here. You can see like a shallow depression. I hope you can see it in the video. You see this shallow depression running underneath the free gingiva. This is called marginal groove. Okay, so the free gingiva, it is also called marginal gingiva. So a depression running underneath it, it is the marginal groove, right? And then the point where the where the mucosa and the alveolar where the mucosa and the attached gingiva meet, this point of color change, this is called the mucogingival junction. So I hope you get all the parts of the gingiva. I'll just go over it once again for the sake of understanding. Okay, maybe I'll just draw this, right? So I have this teeth over here, this tooth, okay, and this one over here. I need to explain interdental gingiva as well. So firstly, I will have something like this, right? And then I'll have something like this, right? So if you look over here, what I have first is I have free gingiva. So this was my free gingiva over here. This will be like free gingiva, which is not attached to the tooth structure. Now the space between the tooth and the free gingiva over here, this will be called the gingival sulcus. Okay, and this is the free gingiva. Now anything below the free gingiva up to the mucosa, because in the mucosa we see a color change. This is the attached gingiva. Okay, and the point at the junction of the attached gingiva and mucosa, this is called the mucogingival junction. Okay, now we see a groove and a depression running underneath the free gingiva, a depression running like around 1 millimeter, 0.5 to 1 millimeter below the free gingiva, that is called the marginal groove. You can see that depression over here, this slight depression, this is called the marginal groove. Now the gingiva present between two teeth. If you see over here, the gingiva present this between two teeth, this is called interdental gingiva. Okay, and if you observe closely, you can see like a depression in here as well. Okay, so the two gingiva, they will have a depression, and this is called interdental groove. So these are the various structures of the gingiva. As you go through them, it will be more clear, right? I'll go over the definitions of each part. So free gingiva, it is also called marginal gingiva. It surrounds the teeth in a collar-like fashion. Okay, it is not directly attached to the tooth surface, and marginal gingiva forms the soft tissue wall of the gingival sulcus. So I'll just draw it over here once again. For this is the tooth, this is the root, and the first part. This was the this is the gingiva. So the first part, which is not attached to any tooth surface. This upper part, this is the free gingiva. Okay, free gingiva. Now it is not attached to any tooth structure. Then we have below this attached gingiva and the gingival sulcus, that is the V-shaped groove, uh, the V-shaped space around the tooth mounted by the free gingiva. Okay, marginal groove I explained to you. Mucogingival junction I already told you, where the attached gingiva and the mucosa meet, that is the mucogingival junction, right? Interdental gingiva, so that is the gingiva between two teeth. So if this is one tooth and this is one tooth, so this gingiva between two teeth, that is the interdental gingiva. And then we have interdental groove, so a depression in the interdental gingiva, that is the interdental groove. And then we have coal. Okay, so this is a pretty important part, the interdental gingiva. So you see a teeth. Okay, I'm looking at it from a side view. I had this tooth, let's just say I had this tooth. I'm looking at it from the front and I cut it from here. Okay, I had this and I cut it from here and I'm viewing it from the side view. I see this. Now what is this? This is the interdental gingiva. Now this is the contact point between two teeth. Okay, and the concave gingiva present between uh, two teeth in the interdental gingiva, this is called a coal. Okay, it is tent shaped in the posterior teeth and it is pyramidal in the anterior teeth. Now why is it important? Because the surface of this coal, it is non-keratinized. Okay, and it is highly susceptible to periodontal diseases. So you should there is often a short note regarding coal. So just know this, that it is the interdental gingiva present below the contact point between two teeth. It is pyramidal in the posterior teeth in shape and sorry, it is tent-like in the posterior teeth and it is pyramidal in the anterior teeth and it is non-keratinized, so it is highly susceptible to diseases. Okay, and it also causes plaque formation. Now coming to the histology of gingiva, starting from the epithelium, the gingiva is parakeratinized in 75% of the population, keratinized in 15%, and non-keratinized in 10% of the population. Okay, so that is about the epithelium, the keratinization. Melanocytes, we know that there are non-keratinocytes present in the epithelium as well. So melanocytes, they provide pigmentation to the gingiva. We know that pigmentation is highest at the base of interdental papilla. Okay, and it can increase in any pathological condition. So the pigmentation, it is an indicator of diseases as well. It can increase in any pathological condition. Now coming to the lamina propria, the papillae are long. Okay, you can see the long papillae and they are slender and numerous. They are almost parallel to each other. You can see that. They contain only a few elastic fibers other than oxytocin. So oxytocin, it is the main elastic fibers present in the lamina propria of the gingiva, and it has special staining properties. So I'll write this down. It has special staining properties. Okay. Other than this, the only elastic fibers we see in the gingiva, it is present in the blood walls of in the capillary walls. Okay. So other fibers are generally confined to the walls of the blood vessels. The gingival fibers of the periodontal ligament enter the lamina propria, attaching the gingiva firmly to the teeth and periosteum of the alveolar bone. Okay, so what this is saying, that I have this tooth, right, and I have the root, I have this gingiva, and then I'll have some fibers. Okay, there are some fibers of the PDL. We'll study that in the later on chapter. They're periodontal ligament fibers. They will come and they will insert themselves into the gingiva to support the tooth. They will be also attached to the alveolar bone. Okay, so they will be attached to this to support the tooth, and they enter the lamina propria. So these fibers, they will be entering into the lamina propria of the gingiva. And this arrangement, it is known as mucoperiosteum. dense connective tissue connecting the collagen bundles, consisting of the collagen bundles, extend from the lamina propria to the bone. So you see these collagen bundles, okay, they are extending from the lamina propria to the bone. So this attachment of the mucosa and the periosteum, the bone, without a submucosa, this is known as mucoperiosteum. You can see a submucosa is absent. Okay, so this arrangement is known as mucoperiosteum. Right. Now moving on, the second topic about the gingiva, the third topic, that is the gingival ligament. Now don't confuse it with the periodontal ligament fibers. Okay, these are different. We'll study this in the later on chapters. These are different. They have similar functions, but there are these gingival ligament. This is a bunch of gingival fibers, and we'll have to study this in this chapter. Okay, periodontal ligaments is a different topic, different chapter. Now, gingival ligament, it is a group of gingival fibers. There are 5 groups of gingival fibers that come in this. The first is the dentogingival fiber. Okay, so if you look down here in the diagram, the dentogingival group, they arise from the cementum. So this is the tooth structure. Okay, the dentogingival group, they arise from the cementum and they go into the gingiva. Okay, so they enter the lamina propria of the gingiva. Now the second group, that is the alveolo-gingival group. If you see over here, they arise from the crest of the alveolar bone and they are attached to the gingiva. Okay, so this is the second group. Then the third group, it is the circular group. So the yellow dots you can see, that is the circular group. They run across the entire tooth. So they're not inserted into any hard tissue. If you see your tooth from the occlusal view and you cut your gingiva, you can see these fibers running across your tooth, and this is the circular group. Now dentoperiosteal group. So dentoperiosteal group is present over here. It arises from the cementum, it goes across over the bone and then it is inserted into the bone. So it crosses the crest of the bone and then it is attached into the side of the bone. Okay, and the last group is the fifth group is there is the transseptal fibers. So the transseptal fibers, they attach two teeth. Okay, they are present between two teeth and they run across your entire maxilla or mandible. Okay, so these are the transseptal fibers. Right. Now coming to the very last topic of this lecture, that is the vermilion border of lip. This is a non-masticatory mucosa. So it is not involved in mastication, but it is keratinized. Okay. So it is a transition area where outer area of skin meets the inner mucosal surface. It is characterized by abrupt change in the tissue type. I'll explain that. So what is vermilion border of lip? This is the lip. Okay. This is the skin. This is the vermilion border of lip. And then this is the vermilion zone. Okay, so this is the vermilion zone and this is the vermilion border. So this structure, it is a transient structure between the skin and the vermilion zone. Okay, or this mucosa. So you can see a change in histology between the skin and the vermilion border. So this topic, what we have to study, it is basically the difference between the skin histology and the histology of the vermilion border. Okay, so it is only present in humans, so that is pretty important as well. And you'll see the differences. What is the difference between the skin and the histology of the vermilion border? So the epithelium of the skin, it is moderately thick, it is keratinized, and it has thick stratum corneum. Whereas in the vermilion border of lip, the epithelium, it is thicker. Okay, so this is thicker and it is a little less keratinized, so it is mildly keratinized. Okay, the lamina propria, the skin will have short papillae, so the papillae, these are like short, but in the vermilion border they have long papillae. Okay, and the papillae have like loops of blood vessels around it. That's why this appears red. Okay, that's why the reddish color is present. So the loops carry capillary, the lamina propria, they carry capillary loops around the surface. Okay, then there are sebaceous glands present on the skin, and there are no glands present on your lips on the vermilion border. That's why you have to like moisturize it. Okay. Now, what we studied about the epithelium, you can see that as we move towards the lips, the thickness of the epithelium it will increase, okay, and the keratinization will decrease. Okay, so the skin has more keratinization and it is thinner, but the lips they have uh, it is thicker but it has less keratinization. Okay, so that's it for masticatory mucosa and vermilion border of lip. If you like the lecture, please like, subscribe. The notes will be on my Telegram channel. Right, you can download it from there. And the next lecture will be regarding non-keratinized mucosa. Thank you.